Hello, I'm Dr. Omar Bey, and this is A Moment in Medicine. Our focus is health, education, and wellness. Our goal is for each and every one of us to have that opportunity to grow old in good health. Welcome to our show. Well, we have a great show for you tonight. We're going to talk about pregnancy. But before we talk about the topic, I would like to go into the most important aspect of the show that I think is called caring and sharing. And we want to share our med moments. A med moment is that moment when you know your body is letting you know that you must see your physician. That pain in the knee, that difficulty breathing, that coughing that won't go away, you know you have to go see your doctor. That's a med moment. Alrighty, so email me, www.medmoments.com, or you can tweet me at medmoments. I look forward to hearing all of your questions and different things that you would like to know. We'll do a show on it. Just email me. All right, so we're going to get to our topic, which is pregnancy tonight. And I have the greatest person to talk about pregnancy, and she was here last time to talk about part one of pregnancy. Now we're going to do part two because we had such a great time last time. We didn't get as much out as we wanted to. Her name is Dr. Yvonne Wright Cadet, and she is an obstetrician and a gynecologist. That's a big word, isn't it?
Yes,
Gynecologist. All
yes,
righty.
it is.
So welcome to our show,
Thank
Dr.
you. It's great to be here.
Yes. So glad to have you. Well, once again, I would like to just go through as far as pregnancy is, and we're going to step back and just talk about a few of the things that we talked about last time. But I would like this time to get into, the stages of pregnancy and the birthing aspect of pregnancy as well. Okay, so to start off, I always ask my simple question: what is pregnancy?
Well, pregnancy is, although we see plenty of pregnant ladies around, I guess the bottom line is when you have two partners who get together and contribute from the man a sperm, from the woman an egg, and they join to form a new human being. So that's pregnancy.
All righty. Well, some of the things that we need to know. How long is a female pregnant before they deliver normally?
A normal pregnancy lasts for about 40 weeks. And for the average woman, we always think of it as 9 months, but it's actually at the end of the 9th month, and that's when you give birth. It's about 40 weeks.
40 weeks, huh?
A long time.
Long time. Tell me about it. Now, in your practice,
Yes.
when do most females come and start seeking information about their pregnancy?
Usually when a woman misses her first period, then she starts to believe she's pregnant. Most women these days in our society go and take a home pregnancy test. And once they sort of confirm it for themselves, they make an appointment with their OBGYN doctor. And usually that's anywhere between 8 to 12 weeks.
Okay.
That's the best time to see your doctor, definitely before 12 weeks, so you can get adequate prenatal care.
Now, is there ever a time when a female may not know they're pregnant? And it goes on and on and on until all of a sudden they realize it and it's late?
That happens not that often, but many women will miss a period and then they have some bleeding and they think that's their period, but it's not really. So they may not realize they're pregnant and then not come to prenatal care until they start feeling a little fetal movement. Sometimes for women that can happen as early as 14 weeks.
Right.
Sometimes women don't feel the baby until they're about 20 weeks, which is 5 months. So that's pretty late. The average woman, though, will be able to tell after she misses her first period. There are a small section of women who actually have irregular periods. So they may normally miss periods for 2 or 3 months and not think anything of it. So that's another set of women who come to the practice a little late. The last set is women who are in their 40s. They think, oh, I'm just missing my period because I'm older, or they think they're going into menopause. So every once in a while, in the 40s, late 40s usually, someone can be pregnant and not realize it. So they come late when they start feeling something or their belly feels bloated.
Right.
Then they go to the doctor because something is definitely not right.
Okay. You said bloated. That sparked a question. What about these cravings? All right, that you get during pregnancy. Do all women feel these cravings? I gotta have ice cream in the middle of the night or something like that?
You know what? I would say more than half do. But the other problem with that is many women have cravings before they have their regular period. So they may get confused by that also. But yes, cravings during pregnancy is very real. And many women do have it.
Tell me about the weight. We all gain weight, and you got a baby that's growing inside, and they're a certain amount of weight. How much weight should you put on during that 40 weeks?
It depends on your weight that you have before you got pregnant. The average weight person, five woman weighing about 130, 140 pounds, they should put on about 25 pounds during the whole pregnancy. That's average. If a woman is very obese, and that has to do with their body mass index, but let's say you have a 5'5" woman who's 200 pounds. That woman, we hope, will not put on a lot of weight, anywhere from 10 to 15 pounds for the whole pregnancy. That seems like a little bit, but it's enough for the baby to grow properly. If someone is underweight, maybe 100 pounds, if they're 5'5", we would love for them to put on about 35 pounds because that baby needs the extra nutrition that they usually don't have in their body fat. So 25 pounds is average. 15 if you're obese, and if you're very thin, maybe about 35. You do not have to gain 50 pounds when you're pregnant. And you're not eating for two.
All righty, I got you. Now, you said something there that I don't think I knew. You utilize some of your body fat to help feed the baby?
Absolutely. We have women who have an illness called hyperemesis. That means they vomit a lot when they're pregnant, and some of those women lose weight. If you're overweight, the baby almost never suffers. When you in the first trimester you're not eating a lot, the baby never suffers. The women who are overweight, the baby can help when you need. The baby's a parasite, so it's not a nice thing to say, but that means it can use anything that is in your body, including your fat. So when people are overweight, they have plenty of excess fat that the baby can use to grow.
Interesting, interesting. All right, let's break this up right now as far as trimesters. So and I know that's how in medical terms they break it up. First trimester, second trimester, third trimester. Tell me about the first trimester when a baby is forming. Give me some idea of what that's about.
Sure. When we break up the trimesters, the first one is the first 3 months up to 12 weeks. And in that first trimester, the baby's doing amazing things. Although it's not getting very large in terms of weight, it's developing a spinal column, it's developing heart, lungs, brain. It does a lot of growing. If it starts with just 2 cells, those cells have to grow in a very rapid rate, and not just grow, but change into different organs. So the first 12 weeks, the baby does a lot of what we call differentiation, which means that one cell turns into different things. It sounds complicated, but one cell now has to break up and form limbs, internal organs, blood vessels, skin, kidneys. And so that first trimester, amazing things are going on inside the body. And if you look at little pictures, you see in the beginning the baby looks like a little tadpole. By the end of the 12 weeks, it looks like a human, a fully formed human. It's amazing.
Now, is it very important during this first trimester to make sure you do certain things like take vitamins, not smoke, and those type of things?
Yeah, absolutely. The baby needs certain nutrients to grow. One of the things that we like all women, even who are not pregnant, to be on is a multivitamin, because there's something called folic acid. They even put folic acid in cereal because it's so important to develop the spinal column and the neural and the nerves of the baby's spine and brain. So that is a very important nutrient. So we want all women to be on multivitamins. Calcium the baby needs to grow, iron, more toward the end, the iron, but the first trimester, women need multivitamins. They need to eat a healthy diet, fruits, vegetables, some starch, and protein. So people need a healthy diet throughout the first 3 months and the rest of the pregnancy, but especially vitamins in that first trimester. When the baby gets into the second trimester, then it's starting to build on the organs that were already formed. So again, you need appropriate diet, and women can do exercise when they're pregnant. You do not have to sit down and put your feet up. The more exercise and the healthier you are when you start pregnancy, the better you will end up in your pregnancy toward the end when you have to go into labor. So we never put women on bed rest unless they have some high-risk problem. You should work. If you're a walker, you should walk. If you did spinning, you can still do that. I only don't recommend things like high-impact aerobics because once you get into the second trimester, the uterus can shake. So you don't want to do a lot of jumping around. But the typical exercise we can all do right up until labor.
Interesting, interesting. So the second trimester is when they really start, these organs start growing.
Exactly.
And the baby the organs are formed in the first trimester, but they start growing in the second trimester.
And in the second trimester, the smaller parts of the organs form. So if you have a kidney, the kidney forms first trimester, but it doesn't work well. So the second trimester is when the internal part of the organs start to form, the little tubules, those things that make it function. So if you delivered a baby who's 12 weeks, although it will look like a human being, it won't survive.
Right.
Because the lungs don't work, because the internal sacs in the lungs are not developed yet. So second trimester, those things start to develop and get more specialized.
Right.
Third, and it's still in the second trimester, the baby's not 100% ready to live outside. In third trimester, though, then the organs pretty much work. After 28 weeks, those organs work. They just need to just be more mature. So that's why now we see so many babies who are born 1 pound, 1.5 pounds who survive, but they have to be in the ICU for a long time because they need support. So second trimester, the organs are formed, but they're building. And the internal parts of the organs, the real special things that each organ does, is now being more developed.
Okay, all right then. Now, the third trimester is, what is it?
It's 28. That's about 28 weeks, which is around 7 months.
Okay.
So 7, 8, 9, those are the last 3 months. Well, depending on how you count it, it could be 8, 9, and 10. But the last 3 months of pregnancy is called the third trimester.
All righty. So that's when everything is, the baby's positioning itself and in there getting ready to, so it's in the right position and all of that kind of stuff?
Exactly. Around 28 weeks, the baby still has plenty of room to move, so it does flip around a lot. Okay. Once you get closer to 34 to 36 weeks, the baby usually settles head first for most babies. Some babies, there's a small percentage of babies who don't want to cooperate, and they are still looking up with the bottom and the feet down. That's called breech.
Right.
Somewhere around 3 to 4% of babies end up breech. We don't know really why, because once we deliver the baby, everything looks normal, but they don't settle in the right position. So about 95% of babies are head down by 36 weeks, ready to
come out.
To see the world.
All righty. Now, a breech baby, that's the feet first?
Or the buttocks first.
Right. Now, do you mean the feet and the head are going up? Like
yes.
they're kind of in a V?
The baby can be in a V shape.
Oh, goodness.
Yeah, we have different names for it. The baby can be both head and feet like a V. The baby can be head up and knees bent with the feet down. And the baby could be sitting in like a lotus position like an Indian. That's a different type of breech. Some babies come with the feet first, and that's, what is that called? A footling breech. So there's about 3 or 4 different names for the type of breech.
How do you deliver a breech? Do you have to actually rotate the baby, or do you? Is it more difficult to deliver? Or?
It's a little more complicated. If the feet are coming first, then that means there's a lot of extra room around the feet where other things can come out first, like the baby's umbilical cord.
Right.
So if the feet are coming first by themselves, we never deliver that baby vaginally. We do a C-section because it's too dangerous. If the baby is a frank breech, that means with like a V, then you can try to deliver that baby vaginally. It depends on your conversation with the mother. These days we try to discuss all the risks of vaginal versus C-section, and then the mother, contributes to what she wants done. If she wants to risk a breech delivery, then we try that. If she's concerned and not, she's worried for the safety of the baby, then we can do a C-section. And there's different factors that weigh in. The size of the baby. If the baby is very big, then we would discourage a breech delivery. If the mother's very small and her pelvis is small, we discourage a breech delivery. So there's a lot of different factors that you discuss, and sometimes breech deliveries are the safest. Sometimes they're the worst. So you have to, come to a conclusion after you look at all the different factors.
All right. You mentioned the word, so I'm going to go there.
Okay.
C-section.
Yes.
Describe what a C-section is and how and I know the thing that everybody's talking about that I hear in the hospital is the bikini line now and all this kind of stuff. Tell me what we're talking about here.
So C-section is short for cesarean section, and basically what that means is instead of the baby coming through the vagina, we cut into the abdomen with a scalpel and deliver the baby. And you can do that in 2 ways. One is, so if this is the abdomen, you can cut this way, and this is the pubic hair, this is the baby, and that's called a bikini cut because you do it right at the line where the bikini would be so the woman can wear her bikini afterwards.
Right.
If you need to and there's some medical reason for it, you can do a vertical incision on the abdomen.
Right.
And that usually is for people who have twins, or if they have other complications like fibroids, or if the baby is very small and you're worried about having enough room to get the baby out, you may do a vertical incision. So usually I would say 95% of our C-sections are bikini cuts.
Okay.
And we're getting real sophisticated now. We used to use staples to close the skin all the time.
Right.
And now people want just stitches. So now we just put stitches in so they have almost an invisible incision.
Oh, no scar.
Virtually no scar.
I hear you.
Now, and a cesarean section has risks. It's more blood loss.
Right.
It is major surgery, so the mother's life has to be considered. They're very safe these days because of modern technology and antibiotics, but if at all possible, we like to do vaginal deliveries.
Yeah, normal delivery.
In our country, the rate of C-sections have skyrocketed, and lots of it has to do with people worrying about the risk to the baby and the risk of not having a healthy baby and the risk of being sued. So sometimes C-sections are done because a woman has had a C-section before and she's having a repeat C-section. Right. That's not always necessary, but it's exciting either way. I mean, we're more concerned about the safety of the mother and the baby, so we decide at the time of delivery which one is going to be safer. I tell my patients my goal is for them to have a vaginal delivery unless it's going to harm them or the baby, then the C-section.
Right. Tell me about the placenta. Okay,
Yes.
What does that do, and what is a placenta?
Sure, no problem. When the egg and the sperm start to grow, they actually don't form the baby first. They actually there's an implantation into the uterus because the baby has to attach to something to live.
Okay, let's step back just for a second because you're getting fancy on me.
Oh, okay, I'm sorry.
When you say uterus, this is the womb that the baby is housed in.
Exactly.
All right.
All women are born, for the most part, with a womb.
Right.
And that is a little sac about, when it starts out, it's a muscular organ about the size of a pear, tiny. And there's a hollow cavity inside that's going to hold the baby. Before a woman gets pregnant, that's where her menstrual flow is every month, and that's why women have periods. The menstrual flow is waiting for a baby. Baby doesn't come, you have a period.
Right.
When a baby does show up, then that baby kind of digs into the wall of the uterus. And starts developing. It develops a placenta, that's one half of the tissue, and then the other half is the baby. So it develops this placenta, and that placenta is attached to this other set of cells, which is the baby, and that attachment is called the umbilical cord. Everyone knows about the umbilical cord.
Right.
That's where our navel is. So that umbilical cord develops, and that placenta grows and grows and grows. And it sends blood between the placenta and the baby. So on this side, it's attached to the mother's womb. It's getting food and blood from the mom. It goes through the umbilical cord and gives the food to the baby through the blood. So the baby gets all its nourishment, its oxygen, everything through that blood supply. What's even more strange is that blood from the placenta never gets into the baby's body. It just goes through a little film that blocks the mother's blood from the baby, and it's like a little filter. All the nutrients pass through the filter, go to the baby. The baby, all his waste products go to that film. The waste products pass to the mother, and she gets rid of the baby's waste products. And then the mother's blood comes back with some more food, and the baby's blood comes back with more waste products.
So the mother's blood never really goes into the baby. They just kind of pass each other in a filter in between.
Exactly.
And all the nutrients and all of the
waste,
oxygen and everything just goes back and forth, and all the food and everything the baby needs
goes to the baby, and then the baby says, okay, I used all this food, here's the junk, take it back and throw it in the garbage. And that goes into mom's bloodstream, goes out of her urine, goes out of her stool.
Interesting.
The only thing the baby does when it comes to excreting things or going to the bathroom is it urinates. And that's the baby's amniotic fluid. The baby lives in its own urine, but it's clean and sterile. Doesn't look like ours. It's clear, crystal clear, beautiful fluid.
Interesting.
But the baby doesn't, if the baby poops, it's a problem.
Okay.
And usually it doesn't. But toward the end of the pregnancy, it can.
It can. Oh my goodness, interesting. That is so interesting.
Isn't that exciting?
To think of it that way, It's very interesting that, but what that placenta does, and it attaches to the womb, the inside of the womb of the mother, and it allows all that exchange.
It does.
Very interesting. What about as far as now? Certain things I worry about as far as babies and giving birth and stuff like. What about age? Is the mother's age? Is there does that increase the risk as far as the baby is concerned or the mother is concerned?
Yes. We consider women probably in their teens, under 18, to be high risk when they're pregnant. Teen pregnancy, women who are pregnant in their teen years have more risk because their bodies are not as developed. They tend to be less nourished and a little less reliable when it comes to doing what they need to keep the pregnancy healthy. Right. So you have to eat a healthy diet for your baby. You have to take your prenatal vitamins. Right. So the younger women tend to be a little more risky because of their, I guess, their immaturity, their body's immaturity and their mental immaturity. Women in their, after 35, we consider to be a little more high risk because they're older, so the body may not be as healthy. They're at high risk of having abnormal babies, like babies with Down syndrome. They tend to actually be more responsible, so they kind of make up for some of their high-risk problems. Right. But certain things you can't make up for. For example, they're at higher risk for high blood pressure and diabetes, but they tend to come to their visits, be really thrilled about the pregnancy, they're excited. So they have some high-risk problems because of their age, but we monitor them very closely, as we do younger girls, and to make sure if any problem develop, we can address them as early as possible. Right. So really 18 to 35, that's the ideal pregnancy time.
All right. Okay, that's great. Genes. Okay, those little things that set the chromosomes and everything. How important is that as far as what the baby? I know as far as what the baby's going to look like and how tall they are, and
right.
But I know that there are other things that we worry about as far as genes are concerned.
Yes, we worry. I mean, the contribution from the male, 23 genes, chromosomes, all of them have little genes on it, and from the woman, 23, they have to match together perfectly to form 46, which is a normal human being. Oh, all right. When that exchange happens, some little thing can go wrong, and an extra gene can flow into the baby, and that could be something like Down syndrome. So the pregnancy itself can be complicated because the genes are not right. There are other things that can be genetic that we can't predict for years, like people may have a predisposition to diabetes or hypertension or type 1 diabetes. Right. There's just something in the genes that is not normal, so the baby will have some kind of health problem. A simple one we all know of is sickle cell. Right. African Americans have a high risk for sickle cell disease, so we test beforehand, but we can't guarantee that a baby won't have a gene from mom and dad that will give them sickle cell disease. So genes control everything, just like you said, from height and weight and eye color, but all your history is in the genes.
Right. I want to ask about, you had mentioned earlier that some babies at the second trimester, now we have the capability to keep these babies alive and for them to grow naturally. And obviously they would go into the ICU or the pediatric, or not pediatric, but the
neonatal.
Neonatal
ICU.
Yeah, the
right.
fancy word. Tell me about that. How do you, do you put these babies, do you breathe for them? Do you feed for them, feed them? How do you handle such a
tiny baby?
Tiny baby.
It's a challenge. I admire the neonatologists because these babies are so little that they have to feed them. They have to give them liquids. They take the umbilical cord and put an IV in there instead of giving an IV in the vein. They usually put a little tube down the throat into the stomach to help feed them and to take out any fluids that don't belong in the stomach. They breathe for them. They put them on a ventilator. You know all about that with your adults, but they do it for little babies, and it has to be a very delicate operation. The thing we try the most of is to not have them born. We try to keep them in as long as possible. Right. And we try to give medication to help the mother to not go into labor, and also some medicine to help the babies through the mom's body. Right. So the goal is not to have them born too early, and if they are, then we hand them over to the neonatologists, who usually do a great job with all these little tiny bodies to try to keep them alive. They breathe for them, they drink for them, and they feed them through a tube.
Now, is that where bed rest comes in? Usually?
It depends. If a mother's in preterm labor, then she's on bed rest. If the cervix starts to open, the cervix is where the baby comes through. If it starts to open too early, we try to give medicine to make the cervix not open anymore, but we also try to give them bed rest to see what we can do to stop their labor.
Okay, all right. Let's talk about labor because we're running out of time, and I at least wanted to talk about that. When should you run to the hospital? Because it's time.
Yeah, it's usually time when the average we say is when you're having contractions anywhere from 3 to 5 minutes apart, and they don't go away after a couple of hours.
Right.
Then it's time to go get checked. If it's your third or fourth baby, maybe you should go the first hour because you're usually going to go a little faster.
Right.
If it's not your first baby. If it's your first baby, you have a little more time. Usually 14 hours of labor for someone who's never had a baby before is kind of average. But if it's your third or fourth baby, you can have a baby in an hour. So once you discuss with your doctor how your previous pregnancy went, then you know when to run to the doctor. But for the most part, your doctor's a phone call away. You call your doctor give you the card. The answering service is available. So when you're not sure, call your doctor.
All righty. So you would go to the emergency room or come to the hospital just to make sure, just to check up.
Absolutely. Absolutely, because you don't want to have the baby at home if that wasn't your plan.
Right.
And we always monitor the baby in the hospital, make sure the baby's fine. If you start contracting, we want to know that the baby is handling the labor properly.
Right, right. All righty. Well, our time is up. As usual, this has been an excellent show. Thank you for coming to speak with us on the second half of pregnancy, because I tell you, I've learned quite a bit today.
Very good. Thank you.
Thank you very much.
Thank you.
All righty. In closing, well, remember sharing and caring. And our website, www.medmoments.com. Don't forget the S now. That's www.medmoments.com. And you can tweet me at medmoments. Well, never institute any change in your medical therapy until you consult your physician. I trust each and every one of you continued good health. I'm Dr. Omar Bey, and this is A Moment in Medicine. Until next time, peace to you all. Thank you for coming in. Thank you very much.
A pleasure.
As usual, it was excellent.
Very excellent.
Yeah.
Wow.
Good time.
That was, now that it's the second time, it was so much easier than the first.
That's easy. But you know what, then? But you were very easy the first time.